My name is Eileen Torello, and I'm an OTA student at Goodwin College. Today I'm going to show you how to use two pieces of adaptive equipment. The first piece of adaptive equipment is a sock aid. A sock aid is used to help a client put their socks on. Usually the client will have limited range of motion or muscle weakness due to an injury or surgery such as a hip replacement. It can also be used for energy conservation. This is important to occupational therapy because it helps a client to become as independent as possible while doing some ADLs. For some clients, it can be frustrating and even embarrassing to ask for help to put your socks on. With this sock aid, they are able to do it themselves. I'm going to show you how to use the sock aid. What you're going to do is you're going to take your sock, you're going to put it between your legs as you put the sock on. You're going to bring the heel of the sock all the way back till it can't go back any further. Then you're going to put it down to your foot and you're going to pull with the straps until it's completely on your foot. And then repeat the same steps with the next foot. The second piece of adaptive equipment is a scoop plate. This scoop plate is used to help a client with feeding. Usually a client who has hemiparesis or is a hemiplegia, it will be used for. It also has a non-skid surface, so when on the table, if you accidentally move it, it will not skid. How you use the scoop plate is you take your utensil and you bring your food over and you use the curved edge and your food will come on your spoon. Usually you can use chicken, applesauce, even candy. This is important to occupational therapy because it helps a client to become as independent as possible. For some clients, it can be embarrassing and frustrating to have to ask for help with feeding or to watch your food fall off your plate. With this scoop plate, you are able to go to the curved part with your food and push it, and it will land on your spoon. First, let's demonstrate the sock aid. You're going to bring the sock aid between your legs and put the sock on till the heel is all the way. Now bring it down to your foot and slide it into your foot and keep pulling until your sock comes completely on. Then repeat. Now we're going to demonstrate the scoop plate. First, we're going to start with the M&Ms. Place the M&Ms in the scoop plate and push the M&Ms up to the curve. Now we're going to demonstrate with the applesauce. Push the applesauce up to the curve. This concludes this segment of showing you the two pieces of adaptive equipment. Just to review, the sock aid is used to help a client put their socks on to be as independent as possible. Anyone can use it with limited range of motion, muscle weakness, or for energy conservation. A scoop plate is used to help a client with feeding. It can be used for someone with hemiparesis or hemiplegia, and it has the non-skid on the back, so when it's placed on the table, it will not slide as you use the spoon up to the curve. Overall, both these adaptive equipments have two different purposes, but together it makes a client as independent as possible when doing ADLs.